Good morning and welcome to Health, Safety, and Innovation for Smart Borders. The session is part of the Rising Economy Week, an immersive week-long virtual event co-hosted by the South Island Prosperity Partnership and the Pacific Northwest Economic Region. I'm Matt Morrison, as CEO of the Pacific Northwest Economic Region, which includes Alaska, Washington, Oregon, Idaho, Montana, British Columbia, Alberta, Saskatchewan, the Yukon, and Northwest Territories. And we are 5 Canadian jurisdictions, 5 US jurisdictions. So this morning we have a fantastic panel that has been working for decades on smart borders. And it's obvious now that we're in the midst of a pandemic and our borders are closed to all but necessary commerce and travel. But since March, middle of March, there have been a succession of 30-day extensions of the border closure between Canada and the US. In this part of the region, it's a big deal. And I know I'm speaking to many people who live on Vancouver Island and the Lower Mainland, and we know that you don't want any diseased Americans over there, and we appreciate that. But what we need to do is really look at how we develop criteria, science-based, health-based criteria, to look at the easing of restrictions. And we'll be talking about that along with innovative ideas and how we are going to have to reshape the way we look at borders. So I'm really pleased to be joined today with Gerry Bruno, who is the executive advisor to the CEO of YVR, the Vancouver Airport Authority. In that context, Gerry is strategically thinking on behalf of YVR about the border, quarantine zones, policies, free trade zones, many areas that impact YVR. And more importantly for this morning, Gerry is the founder and the CEO of the Future Borders Coalition, and that he chairs and I co-chair. And this has been a fantastic 3-year experience of working with stakeholders across North America on the border and all aspects of the border, all modes. So next we have Laurie Trautman. Laurie is the director of the Border Policy Research Institute at Western Washington University. Laurie is a dynamic spark plug and looking at all aspects of the land border. She co-chairs the Future Border Coalition Land Border Task Force, Recovery Task Force. And you'll be amazed at the specific innovations that she'll be talking about today. We also have Solomon Wong, probably one of the most brilliant guys who's worked his whole life on border innovation. And as president and CEO of InterVISTAS, he has a global reach and works with airports and with countries from the South Pacific to Europe. And we'll be hearing from him about some innovative ideas on border policy. So let me get right into if we could see the first slide. I'm going to just lead off on what the Future Border Coalition is about. And as I mentioned, it began really as a pre-clearance, beyond pre-clearance coalition 3 years ago, looking at how do we initiate a process for our land border and our air and our sea borders. And it's true that every 5 to 7 years, if you go back, we had the CUS, the Canada-US Partnership, And we had the Shared Border Accord, Smart Border Declaration, the Security and Prosperity Partnership in 2005, and then the Beyond the Border Action Plan with it seems like every time there's a regime change, either in the US or in Canada, we move to a new initiative on how we're going to handle our border relationship. And 3 years ago, Gerry and Solomon came to me and said, we are adrift. We do not have a new initiative. And that led to the Beyond Preclearance Coalition. Here are some of our coalition partners. It's a very big list. It covers railroads, airports, seaports, cruise lines, cities, chambers, NASCO, the North American, and anyway, it's a huge list. Here's a number of our partners. And what's important here is that there was a void and a vacuum and a recognition that we have to work together. And the private sector came to the table and said, yes, we need a new vision for how we're going to manage this shared border. And we've had many, many ideas and opportunities here in the Pacific Northwest. Is, you know, we call ourselves the pilot zone. We would like to initiate pilots that can then spread across the northern border or the Canada-US border in this case. And there was a recognition that we need to put our heads together. And with a real amazing outpouring of financial support, the Beyond Preclearance Coalition put together a white paper 2 years ago and held 3 major summits. Here in Vancouver, there was a major summit in Washington, DC, bringing out some of the ideas in this white paper, and some of them you'll hear about today. But on the website of the futureborderscoalition.org, you can find that white paper and a number of the task force reports and also the summit reports. And I would encourage you to check that out. So with that, I'm going to turn it over to Gerry to talk a little bit about the structure and organization of the Future Borders Coalition. Gerry?
Oh, thank you, Matt. As Matt mentioned, he and I are co-chairs of the board of directors. We try to establish a board of directors from among our members that represent various sectors and different parts of both countries. We've got Matt Cornelius, for example, from Airports Council International in DC, Jennifer Fox from NASCO, Jess Ketchum representing Rocky Mountaineer, Scotty Greenwood, who a lot of you know, president of the Canadian American Business Council, Donnie Brown from Cruise Line International Association, Mike McNanny from the National Airline Council of Canada, and Laurie McKee from Toronto Airport. So in addition, we've got a treasurer, a secretary. We also have officers who operate, basically myself as executive director, Alana Lawrence, who's my deputy, and Solomon Wong and the InterVISTAS team provide property program management support. So it keeps all of our activities in line. Next slide. So one of the things we had, as Matt mentioned, out of our summits, we ended up with about 10 working groups that were trying to push forward ideas from our white paper, ideas for pilot projects, new initiatives, etc. And then early in the year with COVID, the board of directors, we had a meeting and said, all right, we need to re-pivot. We have to look at the borders are closing, and it's no use trying to make the border more efficient when it's closed. We need to work on border recovery. So the board itself became the Border Recovery Working Group, which again, Matt and myself co-chair. And we established 4 task forces under that: the Air Border Recovery Task Force that I co-chair with Matt Cornelius from ACI, the Land Border Travel Recovery Task Force that Laurie Trautman co-chairs with Jennifer Fox. And then we have a Supply Chain Goods Movement Task Force and a Maritime Border Task Force that's looking primarily at cruise ships in North America. To the other working groups we had, as I said, we had about 10. We parked 8 of them, and 2 of them, Communications Working Group, is still active. And we've got samples of our publication, which we put out every 6 weeks. Solomon Wong and his team produced that for us under the editorial guidance of our Communications Working Group. And then we have an applied policy research working group as well, which Chris Sands also co-chairs. I think some of you may have seen his presentation yesterday. Next slide. So one of the things we did as a board was establish 4 principles for easing U.S. border closure and other travel restrictions. We didn't call for outright reopening because there are challenges with that, but a gradual phased reopening of the border. We had the main things were it should be binational and coordinated. We should use science-based criteria for reopening the border and a layered risk-based approach. And I'll talk a bit more about that in one of the projects that we're working on, as will Laurie. Then we talked about a need to assess the impact on communities. One other thing, we sent this in a letter to political leaders and senior officials in the US and Canadian governments. We also called out for a public-private advisory council where groups like our Future Borders Coalition, PENWAR, and other organizations could provide input. Matt, I don't know if you want to add anything to that.
Well, we just know from our experience at 9/11 that when borders close, what's important is the process of reopening. And we wanted to ensure that the border user groups are engaged in a dialogue with both federal governments to ensure that whatever restrictions we keep in place makes sense and have common sense at protecting the health and safety of our citizens, at the same time making sure that we have the necessary commerce going back and forth to protect our supply chains and our way of life. So we really are calling on both governments to establish that advisory committee back in July. And we still think it's an urgent thing that needs to be done right now. Thanks, Gerry.
All right, let's move on to the next slide. And this came out of our Air Borders Task Force. I actually came up with this concept back in April, and I was met with a lot of skepticism. The idea of doing testing at airports, everybody thought it would be non-scalable, disruptive, and really challenging to do. Now everybody's doing testing at airports, so we're really pleased about that. One of the things we are working on right now, Vancouver is about to launch a departures test with WestJet next week. Calgary, Alberta, and one of the border crossings have already started their trial. Toronto just completed a trial of testing on arrival. So there's a lot of this going on. But this concept, I just wanted to take you through it. It's still, I think, very valid today. And we're hoping that CTAC and Vancouver Airport can work together. We've got a working group set up to allow flights between the two airports with departures testing that could eliminate the quarantine. So just to take you through it, we're looking at in line with the principles we talked about, a 72-hour COVID test in advance. That could be a sophisticated PCR test, or it looks like health authorities are getting more comfortable with a rapid antigen test, which is great. And then at the airport, when you arrive, you would have the automated temperature checks, which are already in place. But we think we're going to be able to probably phase those out soon if we are doing testing. Do a rapid test at the airport, and if you are negative, then you proceed inside the terminal building, which we call a biosafe zone. And the idea is anyone entering the terminal would have been tested, whether it's employees, airline crew, and passengers. So anyone going inside the terminal would effectively be assured to be COVID free. And then you could relax some of the other things that we have in place, or we may want to keep them, at least in the short term. But I think over time, we would be able to eliminate some of the restrictions so that travel could look like what it used to be pre-COVID. If you go back to the top left there, we have testing at the airport, and beside that, we have the bypass process, which with an immunity passport, which I had in brackets in the future. And that would really be those that have had the COVID vaccine, and we can identify digitally or in some way that they have the vaccine, and they would not require testing to enter the terminal. One of the things we've talked about with the health authorities is that as the vaccine is rolled out, and over time, as more and more people get vaccinated, we'll have to test fewer and fewer people. So that will help, because as passenger traffic grows, it's great if you have fewer passengers that would have to be tested. But we think testing is going to be with us for a long time for a number of reasons. One is there's people who are not going to have a vaccine right away. There are those who are not going to want to take a vaccine, and that's a personal choice. So if they don't want to be vaccinated, then they would have to be tested before being able to travel. Thirdly, even if you have an immunity passport, what better place than an airport during the air travel continuum? We have a lot of frequent travelers. What if we test them every 3 months? And that will help provide scientific data to our health authorities and answer questions like, how long does this vaccine last? Because nobody knows, right? These are new vaccines that are coming out. They haven't even been tried out yet in any kind of long-term environment. But this will help our policymakers have access to scientific data that says, well, this vaccine lasts 6 months, it lasts a year, it lasts 2 years. So we'll be, in our view anyways, we are trying to be part of the long-term solution. Anyways, that would be the process inside the airport. We've already implemented a lot of processes that are touchless to minimize potential contact with things, using things like facial verification, self-cleaning screens, etc. The boarding process, again, could be automated, paperless, using facial verification. Our airline partners are doing a lot, and we've even heard our health authorities say there's very, very little incident of spread of COVID in a flight. So given all that, in the end, you could end up with a process that would allow us to have a no quarantine if you've gone through this. So air travel, instead of being the super spreader, can now become part of the solution for the future. So with that, I'll turn it over to, I believe, Laurie, you're next, and we'll put up her slide. So go for it.
Yeah, Laurie, before you start, I just want to call everyone's attention to if you have a question for any of our panelists, please put it in the Q&A section. Otherwise, you can also use the chat room for a dialogue with any of the participants. So thanks very much. We'll be going into the Q&A section later on in this hour. Okay, over to you, Laurie. Thank you.
Actually, I'm going to jump on right in before turning it over to Laurie to have some thoughts on goods movement before going over to the land border with Laurie. But just to dovetail on Gerry and Matt's points, I think part of the vision for the Future Borders Coalition is the ability to share information and practices from one mode of transportation to another, as well as between goods and people movement. So a lot of the work with the ability of getting pilot projects thought through, as well as priorities, Jim Titsworth from BNSF, Allison Gifford from Amazon, and Bruce Rogers from CIFA, the Freight Forwarders Association, have been leading an effort on critical supply chain as part of the task force. And I think here there are a couple of things that are common in terms of the dynamic. If you listen to Gerry talk about the immunity passport and some of those kinds of things, implicit in there is this period of time that we're going into around what is the confidence we have in the supply chains to help with COVID-19 recovery. And so one of the things that we're seeing is an accelerator for some of the things that are already investments or discussions ongoing that become even more important for recovery. So there are a couple of areas. First, on remote imaging. This is a key aspect of sharing X-ray images or other information in advance, and possibly an interaction with an officer, as you see in the top left-hand corner. And I think here, the ability to help deal with some of the pre-existing issues, intellectual property issues, among other kinds of things, but more critically, how can we do more with less, and at the point in time where we really don't want things bunched up at the border during recovery? There's a lot of pre-processing and time savings that could be critical for recovery. On essential goods and services, there's a lot of effort around how do we actually get to that consistent definition of essential. And that's something that is part of how the policymaking has advanced in terms of the Canadian viewpoint, in terms of travel restrictions, and also how the Future Borders Coalition has advocated for the easing of border restrictions. And I think to the aspects around the great excitement we have over the past day, when you look at the Pfizer and Moderna stats in terms of getting to 94, 95%, and that application next in terms of FDA certification, and as well for Health Canada, we're at the precipice of being able to get to critical supplies and vaccines being part of our North American approach for recovery. But there's a small but important nuance that for Pfizer, there's a requirement for minus 40-degree storage in terms of vaccines. Moderna's solution needs minus 90-degree Fahrenheit or minus 70 degrees Celsius. And from a critical supply aspect, the question we're asking is just, are our supply chains within the Penwar region, within the overall U.S.-Canada, able to deal with this? And we heard yesterday about the production capacity with both countries really should be part of the solution set. But it becomes really important going forward around the track and trace, because you're going to have a mix of employees, travelers, some who've taken the Sinopharm vaccine that's already out. No vaccine is the same in terms of performance. And I think the ability to make sure you have that traceability around how you deal with the ingredients for success, that's also a key part of the efforts around solutions that could be developed in the Penwar region. And there's a lot of there are a lot of parallels just in terms of the amount of biotech and technology cooperation in healthcare that can be applied to solution sets around making sure that if somebody is vaccinated, that you've got some level of confidence for how that will take place. In addition to the steps that are critical for the private sector and transportation industry participants, I listened to Dave Earle's comments from the BC Trucking Association in terms of the measures taken to be able to ensure staff are safe. And that's also part of the backbone for being able to sustain the next 12 months to a couple of years in terms of technology adoption. Third area that is critical is the explosive growth of e-commerce. And when you look at the models that we have here in terms of the growth of Amazon, other efforts around being able to have business to consumer, business to business type of shipments, that aspect of how do you actually handle that appropriately going across borders, that aspect in terms of preparing for that growth is going to be also important, because there aren't a lot of good news stories around just where things have grown, but I know that our friends working in e-commerce are particularly seized with how do you actually sustain the momentum that is at a point in time where there are a lot of disruptions in supply chains by mode, by different aspects and channels of being able to get goods to get to market. And then lastly, and one that is critical to the Future Borders Coalition, is that aspect of how do you get to a model of simplified clearance and collections. There's been a lot of advances over the past decade that we have removed in large part the role of U.S. Customs officers to be toll collectors. I mean, trying to make change for $5.50, that kind of thought process, that has moved to other mechanisms. So if you look at what are the ways that we can get to fully touchless environments, doing more with less, and then the vision you see on the right-hand side of the screen in terms of air to ground or ground, and you could extend that to rail as well in terms of having a green corridor so that you're dealing with more well before you get to a border point of any sort, as well as leverage technologies from imaging, information, and others. Not necessarily to get to a super fast speed corridor, but the key here is reliability and predictability. And those two aspects are going to be important to be able to make sure that in the near term, we get the supply chains to get the critical PPE and vaccines and other aspects to addressed in the least amount of time. The World Health Organization has already estimated that 50% of vaccines actually go to waste. That is not acceptable for our region and both our countries in terms of any loss in terms of both the human factors and getting vaccines distributed. But in the near term and into the medium term, that vision of being able to get the bounce back for economic recovery for both countries just depends on the ability for an integrated supply chain to fully take advantage of some of the hard-won provisions in USMCA, as well as other international trade deals that are going to be able to fuel both our economies. So from the goods movement side of things, I'm going to turn it over to Laurie now to talk about our passenger and other land border type things.
Thanks, Solomon, and thanks everybody for being here. And maybe I'll just start out with a thread that Solomon kind of spoke to, which is that we're kind of, even before the COVID pandemic hit and the border restrictions were put in place, I think we were on the kind of the cusp of a new era of border policy, which was really moving away from paper-based systems to much more advanced technology at the border and more virtual platforms. And so we're kind of at this point now where we can leverage the situation that we're in to really implement a lot of those approaches and maybe even push them farther ahead where they need to be. So one of the things that our Land Borders Working Group has really been working on is kind of thinking about the future of border policy within the context of the COVID-19 pandemic, because we're likely going to be living with this for quite some time. So we've been trying to think of ways that we can make the border, and specifically the land border, which obviously functions quite differently than the air mode, ways to make it more seamless and more touchless. And a lot of that comes down to the type of documents that people are using. So we've been advocating for more RFID usage, especially vicinity readable RFID, so that you're not only protecting the traveler's health, but you're also protecting the border officer's health, because you don't have a document being passed back and forth between the traveler and the officer. So kind of a piece of low-hanging fruit, which is something that we should have been doing already, more RFID. It's good for security, it's good for efficiency, and now it also has a public health component that makes it advantageous as well. And a similar approach would be taken with more biometric processing. We've seen just in the last month or so, US Customs and Border Protection has been piloting more facial verification at the land ports with pedestrians. And in those situations, you don't even have to have a document because your face is your passport. And so very ideal from a public health perspective in terms of not actually transmitting any documents. Another key piece that we're really going to have to grapple with, and Gerry spoke a lot about this as well as Solomon, which is how we can establish platforms for communication and incorporating health information between a traveler and a border officer in the border crossing environment. And so it's fantastic that we're seeing a lot of these pilots being happening in the air mode, because we're figuring out how those platforms can be secure, how they can be verified, and how they can transmit that information from a security perspective, but also from an efficiency one of how that can work in terms of boarding airplanes. As I think Gerry mentioned, there is a pilot right now, not only at the Alberta airport, but at the Sweetgrass crossing in Alberta, that allows returning Canadians to cross the border and then take a rapid test and then take a follow-up test, which is more thorough, to enable them to reduce their quarantine. And that's a great approach to building up some data and figuring out how this stuff can work, but it's a post-clearance model. So what we really think is important is a pre-clearance approach. And I think this is important for the air mode because you ensure everybody is COVID-free before they're on the airplane, but also important from a land border perspective as well. So we would like to see this pre-clearance approach that is done away from the border, where health information is verified not necessarily by the officer in the booth, but through a database communication system before the traveler arrives at a booth. And we also think that, you know, from a collaboration standpoint, starting with testing this through the Nexus environment could work really well. So I'm just going to walk you through what is on this screen here and what our pilot project is that we are recommending. So the idea here is, you see the number one box is there's testing criteria. Obviously, there is still things to be worked out in terms of what the testing turnaround time should be, what type of test there should be. But this, the technology and the testing is moving very quickly. So we're relying on that information to inform what that testing criteria would be. And of course, it would have to be agreed upon by public health agencies in both the US and Canada. So let's say I'm a Nexus traveler and I get my test, which is a 48 or 72-hour turnaround. That test is done in advance. I get those test results. And then before I travel to the border, I upload those test results through a secure database. And of course, if my test comes back positive, I'm probably not going to upload those results because I'm not going to try and cross the border. So ideally, I'd have a negative test. I would submit that to a database. And then when I arrive at the border and I scan my Nexus card through that touchless, seamless process through the vicinity readable RFID, that officer in the booth sees sort of a pass or fail message as to whether or not I've taken the right test, that test has been verified, and the window of sort of opportunity is correct. Now the key here, there's a lot of obstacles that we can talk about in the Q&A, but the key here is that the database is not necessarily shared with CBP or CBSA. The health information is not shared with the government. It's a database that I voluntarily upload my information to that they can query. So a couple points here. The idea around this pilot project is not necessarily to say that we should, you know, open the border tomorrow and allow people to be moving back and forth. The idea is that we may be with these border restrictions until, let's just say, spring. Well, we need to start testing these processes out now because there's going to be hurdles and there's going to be obstacles. And as Gerry mentioned, these are also opportunities to collect data, not just on best practices, but how accurate these processes and the testing results themselves can be. So if we can start that process now then when the border restrictions are in a situation to be able to be lifted, we have a plan in place and we have an approach in place. And again, starting with the Nexus program has some obvious benefits. One, we already have that seamless sort of touchless processing environment. Two, there's already a database of people that are part of that program that could be contacted to participate in the pilot project. And three, it's already a program where somebody like myself, who is a Nexus member, has volunteered to give more personal information in order for expedited passage to occur. And then finally, I think a really important kind of fundamental piece of doing a pilot project through the Nexus program is also that it ensures that both US Customs and Border Protection and Canada Border Services Agency, as well as the respective health agencies in both countries, we got a lot of players involved, are collaborating from the very beginning. And that's really important because we don't want a situation where the US has one system and Canada has another system and they're not seamlessly integrated. And that's not to say we can't have different standards or different requirements, but from a user traveler perspective, we want that to feel like a seamless process. So our region, the British Columbia, Washington State region, has more Nexus enrollees than anywhere else along the US-Canada border. We have great organizations, collaborations, and infrastructure in place. And so we are hoping that we can advance this pilot project to be tested out here in this region to just see if that piece of health information can be communicated in a secure and seamless way. And then we prove that concept, we can learn what works and what doesn't work, and then we can think about how to expand that out to the broader population. So one final point that I might make just before I turn it over is that you know, we've got so much good collaboration in place between our two countries, and we're really reaching this time where, again, if we don't sort of start to think about these in a similar way, we might end up with a thickening of the border, and that's really the last place that we want to be when all of this work has already been done in such a wonderful way. And Penwar has been a great part and a great partner in a lot of that. So thanks.
Thank you so much, Laurie. We have a couple questions, and I'd like to go back to Laurie and Gerry. What is the response of our two federal governments to these ideas, and have you been communicating with them, and how do you expect that we'll be able to actually implement some of these? So first to Laurie, I know you've recently talked to the person, Adele Fasano, in charge of innovation for CBP. What was her response?
There's some receptivity for sure. They are very open to partnering, of course, with CBSA. And I think the general sentiment is that Canada really has to come to the table and engage in these conversations. And that's not to say that they haven't. The conversations just haven't been initiated yet. And one of the major challenges we're facing is the quarantine approach in Canada. And so these sort of initial pilot projects, especially Alberta's, I think, pave the way for testing out, can there be more efficient ways of dealing with the quarantine that are also safe ways of dealing with the quarantine. And so that will help, I think, to pave the way for opening up a little bit more the categories of people and the processes by which people are able to cross back and forth.
And Gerry, do you want to comment on that question about
Sure.
federal governments, both in Ottawa and BC?
Yeah, we've been in discussions not only with CBSA and Transport Canada, but also the Health Department. Les Linklater, for example, who is the federal lead on testing and quarantine for Health Canada, Public Health Agency of Canada, our provincial government health authorities and Bonnie Henry's group, etc. And they are participating on our air border task force as an example. They're participating on the tests we're doing with WestJet at Vancouver Airport and the other tests. They've actually encouraged us to do a lot of these tests. I mean, the point we've made to them, as Laurie mentioned, is we need to use this period right now. I mean, we lost last summer. That's really cute, Matt. It's awesome. We need to use this winter period. We lost the summer for travel and tourism, and we can't afford another summer next year like the one we just had. We need to bring it back, and we need to use this period in the interim where it's not exactly the strongest travel season anyways, to do a lot of these trials, have the data in place that can inform policy decisions in Ottawa so that we can safely start to reopen borders. One of the points we've made, and I think they're listening, is we may want to look at travel segments. Someone who's retired and from Canada, who's got a place in Palm Springs or is going to Hawaii. They're less concerned maybe about a quarantine on when they return. But business travel, if we're talking about a Seattle, Vancouver, run, whether it's on the land border or the air border, a 2-day quarantine, even that like they're doing in Alberta and they've done in Toronto, doesn't work. It's usually you fly in the morning, you fly home at night. Well, it doesn't make sense to quarantine for 2 days on that type of a trip. But we are dialoguing with them. Actually, we are hosting on the Canadian side, because that's really where the quarantine issue is, and more resistance on reopening the border. On December the 8th, where Future Borders is hosting a webinar with the National Airline Council and the Canadian Airports Council. And we've already got participation from key government officials on, we're going to have a government panel and an industry panel, and then a roundtable on solutions. So they're there, and they get it, they understand. Unfortunately, government sometimes moves slower than we would like.
Thanks very much, Gerry. Let me go to Solomon. Number of questions on privacy and who owns the data and how does the data handshake work?
Well, I think here is a critical area of leadership that folks in the Penwar region can be. As I mentioned earlier, the parallels with the healthcare sector, a large amount of providers in cloud solutions, whether it is Amazon Web Services or Microsoft Azure, as well as the ultimate principles around privacy by design in terms of I own my own information. There are definitely legal rules specific to individual states and geographies. The United States with HIPAA, on the Canadian side in terms of handling of information. So the model that we are seeing is that there needs to be, first of all, an agreement on criteria. Let's take testing, for example. Is a test valid for 24, 48, 72, or 96 hours? Currently, globally, it is all over the map right now in terms of that validity period, but there are a lot of efforts to be able to get to that measurement. And second of all, of course, is the accuracy of the test itself. So once those criteria are understood, as well as the concept of operations, then what groups like Common Pass, which is an activity of the Rockefeller Foundation, we've had some good discussions at Future Borders Coalition in terms of moving that to a simple 1 or 0. You pass the criteria from a health perspective or not, so that you limit the amount of detail around the information that's actually sent to either a foreign government or an entity. But the reliability of the system depends. Can you absolutely be sure that that criteria is met, yes or no? And I think some of the opportunities that Gerry and Laurie described provide good use cases to try out that kind of infrastructure through Common Pass or other platforms that are able to make sure that you're thinking about a bi-directional journey in terms of going to a destination, coming back, and it's the same language. Today, as I mentioned, it's still a bit all over the map, but now's the opportunity to get to a common set of standards from a criteria standpoint Otherwise, we're going to be having an apples to oranges conversation to try to get people to use the same health status comfort level.
Our colleague Don Alper is asking, with new budgets being proposed on infrastructure, how are we working together to make sure that this can be implemented and that we have a joint US-Canada plan? Anybody want to comment on that?
Well, you've already got an application in, Matt, to Department of Commerce for some funding. But yeah, we are in discussions, certainly with our federal government on the Canadian side, and I'm relying on our U.S. colleagues in the coalition to work on the U.S. side. Now that we're going into a new administration, I think it's really important to make sure that the two governments speak to each other on these things. I think we can provide a voice as a binational coalition to try and bring the two governments together on some of the funding opportunities.
Just another question about, what about metrics to determine when airline flights should be restricted travel, like at land border crossings?
Well, we're trying to go the other way.
Yeah, right.
I go ahead.
No, right now, air travel is less restricted than the land border.
Correct. But where we have the issue on the Canadian side is the 14-day quarantine kicks in, whether it's land or air. If you're flying from Canada to the US, in most cases, there is no quarantine. But some states like Hawaii and Alaska and others are requiring tests, COVID tests, before you travel. So we need to address that, and I think we are going to see an easing of air travel as we implement these pre-departure testing regimes that make our health authorities more comfortable that we're not importing the vaccine. The problem we've got, I think, in both countries is you've got state health authorities and we have provincial health authorities. And it's not a simple thing that the federal government on both sides can lift the quarantine and then you get a provincial government slapping one on, right? Which is what we had in BC. The BC government implemented their 14-day quarantine before the federal government did. So we're working. That's why it's important to work with both, right? And we're doing that.
And from a global context, that's also one where Europe set the gauntlet down in terms of a threshold of 16 cases out of a population of 100,000. So at the time when this was put in effect, the United States was not making that threshold. Canada was, and then Canada's rate grew to the point where we were taken off of the green list, so to speak. And that language is similar to my earlier comments, that because individual countries are still deciding what these thresholds are, some arbitrarily, some with science and reason, the language is quite different. I was surprised, for example, to see Qatar put Canada on the safe list for countries coming up November 20th. And so that aspect as well, will change, go up and down. And I think trying to navigate through certainty for travel internationally as travel resumes, that's also something that has to be cleaned up nationally and internationally.
Absolutely. And I think Europe is not even on their own green list right now, given what's happening there. But one good thing, I think in a week or hopefully soon, ICAO will be setting out global guidelines, if you will, for testing for air travel. So we're all looking forward to that. And hopefully that will bring in some international consistency.
So we've got a little less than 10 minutes left. I'd like to ask each of you, what would you want to say to the incoming Biden administration? If you could wave your magic wand, what are your top one or two recommendations?
You want me to start?
Go right ahead.
Sure. Well, I think basically what we've been working on in terms of testing, immunity passports tied to vaccine, et cetera, that they move quickly on that, and that we reach a binational accord that will start to open up our border for air travel, land, cruise, and the concept that I described earlier in terms of layered testing and a biosafe zone and a terminal applies to cruise terminals and ships as much as it does to airport terminals and airplanes. So I think that would be my key recommendation, to work on reopening our borders in line with departures testing, vaccines, and immunity passports.
Okay. Solomon?
I think the idea that we've spent so much time on the successor to NAFTA, we now have USMCA, the key thing for the Biden administration is what kinds of things can make sure that we don't have barriers standing in the way of the trade agenda, and being able to both resume the areas of easing border restrictions, as Gerry outlined, but also when you look at the overall global trends of trade and production, nearshoring, repatriating jobs from overseas, there is an environment here in terms of strengthening the relationship so that we're able to do more from within the Canada-US relationship, Canada-US-Mexico in terms of the trilateral relationship, but also just remove as much of the non-tariff barriers that we can get to just make sure that our economies hum with both passenger and goods movement. I know there's a little bit less of an issue in terms of goods movement just because of the measures that have been taken, but it's all integrated together with the sale of services as well, aftermarket, break fixing, the human relationships that are key to, well, why we're having a video conference today instead of an in-person session, as well as some of the dynamics that bind our people and economies together.
Laurie?
Well, look, the Canadian border doesn't always feature high on our priority list for the US administration, especially since they're going to be coming in with a whole plate load of stuff. But I guess my mission would be that, you know, to really highlight the importance of the border, and to build on what Gerry and Solomon had already said about coordination. I mean, we also need to be much more transparent and have a dialogue, because the 30-day extensions have been really frustrating for stakeholders who have been, I think, wanting a lot more information around what's happening with these restrictions and are there metrics. I mean, there has been very little dialogue coming from the highest levels, and even less transparency about what's happening there. So to build a coalition between the US and Canada that can push these pilot projects, that can have some data, and that can really share that with the public, because there's, you know, especially I think in Canada, there's going to continue to be pushback against easing those border restrictions. And so we need to make sure that we have the data and we have the sort of public information campaign so that people trust that and they feel safe and they realize that these efforts at easing border restrictions, especially for Canadians, are safe and they're tested and they can be implemented without, you know, a pushback from a public health concern.
Terrific. I will say that we're going to have a session on Friday at 10 a.m. about the tourism industry, and I would encourage people to tune in on Friday this week for that session. I would say, you know, just in looking at the U.S.-Canada relation, it is the economic trade relationship is the largest trading relationship in the world. and we take it for granted. So I think we need a much bigger investment to nurture the relationship across from Ottawa to DC. Last night, we heard from Chris Sands at the Wilson Center that he has established a task force with former Governor Chris Gregoire, the former Governor of Michigan, Rick Snyder, Anne McClellan, former Deputy Prime Minister of Canada, and Jean Charest from Quebec. And they will be touring the northern border, listening to folks about and developing a report to both federal governments on the easing restrictions process. And that's a very hopeful sign. But I know that, you know, as we go into a new administration, there is a chance for new ideas, especially in the first 100 days. And I would hope that all of you listening, if you have ideas and if you have thoughts, I know there's a lot of questions we didn't get to, feel free to go on to futureborderscoalition.org and share with us those ideas. Get involved in the coalition. It's an amazing group of public-private think tanks from around the country and from both the US and Canada. Our contact information is here on the screen. I think that this is an exciting time. At the same time, the challenges of COVID make for great opportunities to actually build the technology for touchless border processes. We know that both countries are very interested on the international preclearance offices of using facial verification. That needs to be understood in terms of a context of privacy. And it's a very important dialogue. So I thank everyone for joining us today. We will be having an open session at 12 noon today. If you'd like to join us, just back on the Hoover spot, you can join us at 12 o'clock. Laurie will be co-chairing that with Senator Mike Cuff from Montana. And it'll be a chance for an interactive dialogue from 12 till 12:30 or so. With that, I think we're wrapping up. I want to encourage you to continue to look at all of the sessions here at the Rising Economy Week. And I think especially related to this, the tourism session on Friday. I'd like to thank our sponsors, Royal Bank of Canada and Western Economic Diversification, as well as all of our Penware sponsors for today's session.